Hello, I'm Wayne Rupert, and I'm the author of STEMI Assistant. We begin our brief tutorial here in the Cardiac Cath Lab because this is where the curriculum for STEMI Assistant originated. STEMI Assistant is a condensed, concise 42-page reference manual that presents the latest evidence-based practices for the assessment and treatment of patients with ST segment elevation myocardial infarction, or STEMI. Reference sources include the American Heart Association and the American College of Cardiology's 2013 STEMI guidelines, the 2014 AHA-ACC non-ST elevation acute coronary syndrome guidelines, as well as the evidence-based practices described in 19 recent scientific journal articles. STEMI Assistant is designed to serve in two roles. One is as a traditional classroom textbook, and the other is as an emergency bedside and crash cart reference. Since the early 1990s, I've taught 12-lead ECG workshops across the United States to thousands of nurses, physicians, and EMS professionals. For years, my course workbook consisted of 156 pages. STEMI Assistant is now my primary class textbook. In 42 pages, it contains all of the critical take-home points that I want my students to retain. Of most importance to me as an instructor, when students leave the classroom, they can take STEMI Assistant on the job with them. It's designed and formatted to serve as a standalone bedside and emergency crash cart reference. To use STEMI Assistant in the clinical setting, follow the 7 basic steps that are described just inside the book cover. Step 1. Be familiar with the Universal Patient Management Algorithm. The algorithm is found on page 1. It describes the initial evaluation and management of patients with possible acute coronary syndrome, and it doubles as the book's table of contents. Step 2. Obtain a STAT 12-lead ECG. Also covered in STEMI Assistant are the indications, techniques, and evaluation criteria for obtaining right ventricular and posterior lead ECGs. Step 3. Evaluate your patient's ECG for abnormal ST elevation. The back cover provides examples of abnormal ST segment patterns associated with STEMI, early phase acute MI, and ischemia. Pages 8 through 11 describe the processes for evaluating the ECG for the markers of acute coronary syndrome when the QRS width is normal, how to identify early phase acute MI patterns that sometimes precede STEMI, and current standards for determining ST elevation patterns that are consistent with STEMI. And page 13 defines how to discern the markers of STEMI when right or left bundle branch block is present. Step 4. After identifying the leads where ST elevation appears on your patient's ECG, correlate these findings with the lead sets on the cover of STEMI Assistant. When your patient's ST elevation extends beyond one lead set, select the lead set with the highest degree of ST elevation. With our patient, the highest degree of ST elevation is seen in leads V1 through V4. Using the cover of STEMI Assistant, we select the corresponding lead set, which is leads V1 through V4, and we proceed to step 5, which is to open the book to the page indicated in the arrowhead. In this case, that's page 24. Step 6 is to follow the instructions in the highlighted section at the top of the page, which tell us to scroll through the ECGs in this section to find the one with the ST patterns that most closely resemble that of our patients. In this case, the ECG on page 24 has ST elevation in leads V1 through V4. However, it is missing the ST elevation that our patient has in leads 1 and AVL. Also, our patient has ST depression in inferior leads 3 and AVF. On the next page, we find an ECG that is nearly identical to that of our patient. There's ST elevation in leads V1 through V4, as well as leads 1 and AVL. And like our patient, there's ST depression in inferior leads 3 and AVF. Next, follow step 7, which tells us to refer to the information presented on the open pages to assist us in the care of our patient. The information presented tells us that this patient's ECG is consistent with that of anterior lateral wall STEMI caused by an obstruction of the proximal aspect of the left anterior descending artery. Our diagram of the ventricles illustrates the anatomical region and structures of the heart that are no longer perfused with oxygenated blood and will most likely begin to fail. Because we now have several decades of data obtained in the cardiac cath lab, and numerous scientific studies that have correlated ECG findings with the location of coronary artery blockages found during STEMI, we can predict with reasonable accuracy which complications we will see with each type of STEMI. As emergency care practitioners, we can use this information to prepare for these adverse complications, often before they occur. In this case, that of our patient with anterior lateral STEMI caused by the proximal obstruction of the left anterior descending artery, we will anticipate and prepare to manage all of the complications listed here. STEMI Assistant presents 9 frequently seen forms of STEMI, those seen in patients with the 2 most common coronary arterial anatomic configurations. These are patients with right coronary artery dominant systems, which comprise approximately 75 to 80% of the population, and patients with left circumflex dominant systems, which account for 10 to 15% of the population. However, be aware that the remaining 5 to 10% of the population have atypical or anomalous coronary arterial anatomies, like this patient who has a single coronary artery that feeds the entire myocardium. In such cases, because we really don't know what coronary artery is blocked and we don't know what anatomic structures are affected by the blockage, we really need to anticipate all possible complications, including pump failure, cardiogenic shock, dysrhythmias, even cardiac arrest. STEMI Assistant is currently available in 2 formats, a traditional bound softcover edition and a spiral bound edition. Tabs can be added to make access quicker. We are currently negotiating with vendors to supply a tabbed version. An electronic version for computers, e-readers, and smartphones is currently in development. This version will have links to multiple resources, including tutorial videos covering each type of STEMI featured in STEMI Assistant. A PDF download of STEMI Assistant is currently available to all team members associated with Community Health Systems hospitals, including physicians and all EMS personnel who serve CHS facilities. The download is available via the CHS internal intranet. For EMS personnel serving CHS hospitals, please contact your local CHS hospital EMS liaison to obtain your copy. We welcome your questions, comments, and inquiries. You may correspond with us at stemiassistant@gmail.com, or you may visit our website at www.ecgtraining.org. From the menu bar, select STEMI Assistant. And to my peers in cardiology and emergency healthcare, it is my hope that STEMI Assistant will prove to be both a trustworthy and reliable resource. Thank you for your time.